Hello everyone, my name is Navneet Pannu. For our advocacy project, we have chosen dental therapy, specifically for Washington. Um, Definitely in Washington because they are making more headway with this topic here. So let's go further ahead. So what is dental therapy? So right now in Washington, there are about more than 2 million residents that are not receiving their oral health care needs being met. So they're mostly the communities of color, low income families, and residents of rural communities. So the biggest thing right now is that dental therapy is being practiced in tribal lands, but unfortunately, that is only where it's happening. So Washington has been coming up with a solution to expand dental therapy's scope of practice to go and reach these communities that are suffering and not being their oral health needs being met. So, who are dental therapists? Dental therapists are primary dental care providers. They do provide the regular preventative care, such as cleanings, um, fluoride varnish, things like that. But also, they have additional education to help with basic services such as extractions and restorations. And what that does, it does bridge the gap between a dental hygienist and a dentist. They are not as the same as a dentist because dentists have actually more clinical education. They perform about 500 procedures over 3 academic years per year. Dental therapists have 80 procedures in 3 academic years. So why dental therapists have been chosen is just because they already have the basic skills as a dental hygienist, which can help with the preventative side of education. On top of that, if we are able to deal with more basic services without having the need or there are not enough dental offices in the community, and we want to expand the scope of practice, why not again provide additional responsibilities? So when it comes to the dental care team, a dental therapist is an expansion of it. So it's another role. Hygienist is more specific to preventative care. Dentist is more restorative. But to kind of bridge that gap for a dental hygienist to get additional education to work as a dental therapist, to work in communities such as like we mentioned earlier, rural communities where they don't have a lot of dental offices and don't have access to care. And that is a one-way solution that we can provide for them. So, what are the advantages of dental therapy? So, one big thing is that it's creating jobs and employment in the market, and it also helps with when these students are working and going back to work in their own community. It creates more of a trust in the community there. With that in kind of mind, we do need more schools, obviously, but right now there is one college, Skagit College, that is have the dental therapy program, but it's strictly for the tribal lands right now. But that way, if we were to expand this scope of practice, a lot of people who come outside of the main cities and come to school and work, study and work, they can go back to their own communities, not having to sacrifice that, and it creates more of a job market and opportunities out there. Another way that this is effective when it comes to career pathways is that because that it is a bridge program from a dental hygienist to a dentist, but you're not clearly a dentist, it does become a little more of a cost-effective way for students to become trained and provide services for basic services. This can be quite helpful in a lot of ways. If someone comes in for a routine filling that can be done, it can actually clear up the schedule and give the dentist more difficult opportunities, such as doing root canalizing, crown preparations. But this is one advantage of that it's a more cost-effective way to educate the students in by expanding the scope of practice. So here is a chart on the different distinctions in what are the education requirements for a dental therapist and how does it compare with other fields. So when we talk about the dental hygienist, it's 2 years program, a diploma program. It's all preventative procedures, and it has placement of fillings, local anesthesia, nitrous oxide, and oral assessments and treatment of periodontal disease. So they're already kind of in that scope that they already know how to freeze. They already know how to reduce anxiety with patients, and so this is a great base level and foundation to continue on. When it comes to dental therapy, it is an additional couple of years, depending on if you go straight into the program of dental therapy or you have a dental hygienist and go from there. They do a lot of the same thing, but they do placement of fillings, removal of cavities, obviously do freezing and nitrous oxide. They do treat periodontal disease, but they also have limited surgical procedures that they can perform. So especially if they are working in a mobile clinic or working in a rural community where they're having specific issues, so they can help at least avoid having tooth extractions done and maybe temporarily help fix the problem so these people can go to the general dentist and get their problem dealt with. So when it comes to dental therapy, it's heavily being supported right now. These are the list of organizations that are supporting dental therapy. Right now, the main voice that is opposing dental therapy is the Dentist Association. The Dentist Association are heavily actually not supporting this because they are worried that is it enough education to pass it on with just a dental therapy and making sure that if the procedures are being properly done, so are they trained enough to perform the same, not almost the same, but very similar procedures as dentists, because they do go to schooling longer and they do have more clinical education compared to them. Another is that really just another one is the dentist role being diminished, and I think that's another opposition that they're facing for this bill for dental therapy. As I talk furthermore with my interview, I'll go into it more about the bill of dental therapy. So my interview was with Melissa Johnson. Melissa Johnson here. She's a lobbyist. She's currently working with Bogard and Johnson. She's been working there for 25 years, and she primarily focuses on issues that are related to healthcare. So she does work with other associations such as the nurses, anesthesiologists, physiotherapists. So she does work heavily with the healthcare field. She has other experiences such as working as a policy analyst for the Department of Social and Health Services. She's also received 2 awards, the Friend of Physical Therapy Award from her Physical Therapy Association from Washington and a Special Recognition Award. So she has loads of experiences. She's been working closely with the Dental Hygienist Association for the last 25 years, so she has definitely seen the change in what it was from before and what it was now. So when it comes to the role of advocacy in Melissa Johnson, as I mentioned, she has 25 years of experience. I had asked her the question why did you get into this role and what made you want to proceed with advocacy? She was a lawyer in the beginning, and I asked her, and she said that, well, to be fair, this kind of fell into her lap. She wasn't she just had an opportunity with her partner, and she said, why don't you take over this for a little bit and see if you want to go ahead with it? And something like this that fell in her lap for about 20, and she's kept this going for 25 years. It's pretty amazing. So she has definitely seen a lot of changes in the last when it comes to the scope of practice for dental hygienists, when it even came to the other bills that have been passed in the when it comes to expanding the scope of practice. She has played a key role in advocating that and passing bills. So when it comes to the interview and dental therapy, currently the bill has been passed in the House of Commons, and when I had done this interview at the time, she still had to go and pass this bill for the House of Senate. When I did ask her that, for the longest time, because there has been oppositions from the dentist about they don't want to they don't want to expand the scope of practice for dental therapists other than tribal lands. She said that, well, we have a core team that we're really working with, and the core team has mentioned that why don't we just focus on community centers. So that was she has set a political move to pass this bill, because there was a lot of opposition for many years now. They have tried to put this bill through for many attempts, and they still keep getting it back. Even when it's the House of Commons, I had asked her what was the voting numbers, and I think it was, they won by one vote, which was, I think, 53 or 52. So that was a very close margin. So there's definitely some oppositions. The Dentist Association plays heavily into the legislative as well. They do support big campaigns. They contribute millions of dollars. So they do have big voice, and so it has been difficult to push the voice of dental therapy into Washington. So I think that was the biggest thing that she has seen, is that, like, really expanding that scope of practice has been difficult because there is so much opposition, even though there's so many associations, and I had probably that list earlier for supporting the bill. But it takes step by step. We'll see what happens in the House and Senate to pass this bill, and hopefully once this does pass, that we can start seeing dental therapists start working in at least community centers in more public health, which is still an amazing step. And the cool thing is that Washington was one of the chosen states to try to do this essentially experiment on. She was explaining that they really had chosen a few states out of the United States, and Washington was one of them, and they wanted to see if this can be something that they can support. There is obviously that the first time it's being done, so there is a lot of, we're comfortable with what we're doing and let's not expand too much on it. But that's one thing that we're definitely seeing, is the just that opposition. So I think as a dental hygienist, you want to get into advocacy if this is something that you really want to pursue. Even Skagit College needs to change up their quota standards as well if they want to, if this gets passed in the House and Senate, to accommodate the fact that this is not just for tribal communities anymore. If you do go on their website, it just mentions that this dental therapy is for tribal communities only. So if that were to expand to community centers, it can slowly and hopefully expand to just private practices as well. So one thing that I had asked Melissa was, where do you see the future of dental therapy and the things that she's seen? She said, honestly, the role of dental therapist is something that I would like to see it expand from that people just choose this more as a career. It's not something that they don't want to kind of think about as a back burner anymore. If someone wants to go for dental therapy and not necessarily become a dentist, I think that should be more in the scope of practice. Obviously, the future is to pass it to, so they start working in private practice, and then hopefully that even there be a bridge program between dental therapy to dentist. So if you are already a dental therapist and if you want to become a dentist, that would be the future of this bill as well. But it has taken this long to get to this point, so we'll see how much more it gets done in the next few years to really add to it. This is my presentation on dental therapy. Thank you guys.